Super.
And we're going to try to get kicked off here tonight at 5:30 because Dr. Garry says he's got lots of information for you guys tonight. With that being said, I just want to welcome everybody back to our sixth and final session in this installment of the Better with Beef Happy Hour. I'm Travis Taylor, your Golden Plains livestock agent out in the office in Ray, Colorado. And we at Colorado State University are thankful that you guys cared to join in this program. I would like to say this is kind of a fill-in for our Tri-State Cow-Calf Symposium with Nebraska, Kansas State, and Colorado State that we usually put on. And due to the pandemic, we have not been able to do that. So we hope that you find this a somewhat of a substitute for that program. I'd like to thank MJ Fisher that most of you can see up there in that top corner. He's the Central Regional Director for CSU Extension out of the Pueblo office, and Christine Poletich in his office. We couldn't do this without her. She's really coordinated the registration for these programs and been on top of things as we go through this. I want to say a special thank you to Lacey Taylor, my wife and extension agent in the Southeast area, for helping with advertisement for this event. Most importantly, if you can see up there that nice little corner of my screen where that hand's waving, Western Sare has been a sponsor for this program as well. Likewise, Colorado Livestock Association, Colorado Cattlemen's, and the Colorado BQA program for their help in promoting and advertising this event. I hope you were able to tune in or had time to prepare your dish from the recipe by the Colorado Beef Council and have paired it with your favorite beverage for tonight's event. I would like to keep in mind that we're going to take questions from the chat as we go. Dr. Garry said if you have something you're not clear about as we go through and you want to pound that into the chat, we'll pause him, but we would like to ask that all questions be put through the chat. We have a 45 to 50-minute presentation from Dr. Garry tonight, and then we'll take questions afterwards. With that being said, I would sure like to welcome our presenter for the evening, Dr. Frank Garry, who is the Extension Veterinary Specialist for CSU College of Vet Medicine and Biomedical Sciences. And his expertise and research is in the area of calf health management, mortality in adult cattle, total cattle herd health, and he also is involved with livestock worker education. I want to say to Dr. Garry, we appreciate you being part of our Extension Vet program. And with that, I'm going to turn this over for you to share your slides and we'll come back. But thank you, Dr. Garry, for talking tonight, mainly on herd health and focus on the newborn calves.
Okay, super. So let me put this up here first, share, and I'll do this. And if somebody would confirm that, wait a minute, that you're now seeing the slide.
We do see your slide, sir.
Super. Okay.
We're ready for you to steer this ship.
Okay. Well, thanks. Thanks to Travis and MJ for inviting me, and thanks to all you for joining. And the only modification I'll make, I think, to what Travis said, just in all fairness, is the primary extension veterinarian is someone you all know and love. That's Dr. Reagan Adams. And I'm kind of like the short hitter who has like, I kind of like help on the side. So I do like the title extension vet because I love extension, but just to make sure that the primary person who really does the heavy lifting is Dr. Adams. So, but I'm the cattle health guy. So when Travis and I talked about, oops, wait a minute, it's not moving. Let me make sure I do this. There we go. We discussed a bunch of possible topics, but then I listened to Dr. Holt's presentation on delivering calves, and I thought he did a really good job of bringing you through the delivery and some things about perinatal care. And so I said, maybe the next logical topic would be talking about things that affect calves after birth, but still in the neonatal period. So to define that for you, And when I do this, can you guys see if I use a laser pointer? Can you see my little pointer going around?
That would be affirmative, sir.
Good, thank you. So we define the perinatal period as the immediate time postpartum. And as in most mammals, illness and death losses are a somewhat curvilinear thing. The highest risk of disease and death always is in the immediate post-delivery period, because that's a crazy difficult time for animals to adapt to life outside the uterus. And so the highest death losses in baby calves typically occur here. In most surveys, these are 50+% of all losses that will occur occurring these first 2 days. Those losses are primarily, almost exclusively, but overwhelmingly non-infectious. They are usually physiological problems that result from issues that relate to the process of being born and adapting to being outside the uterus. And they are adversely influenced by things like birthing trauma and then other features that influence postnatal adaptation. Of course, a big one for that is environmental conditions. I mean, they're not built as immediate newborns to withstand some really rugged things. And so we could talk about things that influence this, but I thought with Dr. Holt's presentation that, he did a really good job of covering the dystocia delivery and newborn calf care and care of the dam. So I chose to then focus on the next level. Then we tend to look at these as what happens in sequence in life. Once the calf's 2-3 days old, mortality rates decline. And then they continue to decline through the time that the animal is a more or less mature growing animal. All right, so the next biggest set of disease and death loss problems occurs during what we call the neonatal period. That's the first 30 days. You might extend it to 60 days. And the far and away number one cause of illness during this time, not the only one, but far and away major, is gastrointestinal problems, which you will see and is called colloquially scours or diarrhea. And beyond that time, then enteric disease settles down, and then respiratory disease becomes the next leading cause. So we're going to focus here. We're going to focus on neonatal calves, and here we go. And most people refer to this as scours. Scours is the sort of colloquial term referring to diarrhea. So the first important teaching point is that when a calf has diarrhea, it could mean different things. That's just a clinical sign of disease. And it can actually represent changes that are like dietary indiscretions. Everybody listening here has had diarrhea at some point. You didn't go to the hospital or die. It just meant that you ate the wrong thing the day before or something else. So it's possible to get diarrhea that's not really a big league disease. On the other hand, diarrhea can be associated with a number of much larger scale problems, but the most common form of diarrhea is where it is the cause of the calf being ill. And that's where we're going to focus. That's what we call scours. And so the issue here, because it can be very different, because diarrhea can occur with a variety of different issues, is, so do all calves with diarrhea get treated the same? Do we use antibiotics? What's the role of fluid therapy? And that's what I'm hoping to clarify here, because I strongly believe, and if I leave you with this impression, that this is one of those areas where people overuse antibiotics and in fact use the wrong antibiotics. And it's very, very common within livestock circles. And I hope what I'm going to do is show you two categories of disease that are very, very different that should distinguish what you do. Because if you always do what you always did, you always get what you always got. And I think the key thing here is that once the calf is born, you've put all of the fixed costs in. It's set. You've spent what money you're going to spend. For every calf that dies from that point until weaning, to make up the difference for a calf that would have weighed 550 pounds, you'd have to put 50 pounds of extra weaning weight on the next 11 calves. In other words, calves that you can keep healthy or keep from dying during this period of time make a giant difference in what you've already spent and whether you can now be profitable and recoup that and then actually make money. So there's a bunch of ways to look at this group of diseases. Most veterinarians and a lot of people looking at the literature look at it from what I call the textbook point of view, which breaks down, oh, there's cryptosporidiosis, and then there's rotavirus, and then there's coronavirus, and there's salmonellosis. And you either look at them as they're all the same, or you've got a whole bunch of different causes And I'm going to suggest the better way to look at it is that there are really two groups of problems. One are a group of agents that cause what I call localized or superficial infections that only affect the lining of the gut. And the other is a group of diseases that causes inflammation and invasion of the agents into other body systems. And obviously you can tell that these will be pretty different diseases, although on the surface they might look the same. So for calf scours, which is the localized superficial problems, there are basically four primary agents: rotavirus, coronavirus, cryptosporidium, and E. coli K99. And they cause a very similar problem. So at the surface, on a physical exam and evaluating the animal, you can distinguish these as the primary cause, but you can't distinguish which one is operative at a time. In other words, they behave very much the same. The outlier to that group would be K99, so I'll discuss it here. If people have questions at the end, I'm happy to elaborate, but I just want to discuss it and then move on because of what I will show you here. This is singular in that it occurs very early. The reason for that is because K99 E. coli, K99 defines the antigen that is associated with what's called a pilus, which allows it attached to the intestinal cells. And because of that, and because of cell turnover, it can only affect calves very early in life, typically between 2 and 5 days of age. Because of the nature of the bug, the pilus attaches to the enterocytes, the cells that are lining the bowel, and affects them by creating a toxin that makes them hypersecrete. And so it's very rapid. It causes extreme fluid loss, extreme electrolyte loss, and it'll kill calves in 12 hours. When I first was studying to be a veterinarian, this was a giant problem in both the beef and the dairy industries. In the aftermath of that time, or around that time, we developed monoclonal antibodies against it, and we developed vaccines. And because of those, they're extremely effective, because if the colostrum has those antibodies in it, the bug has to affect at a time when the antibodies are there, the antibodies tie it up, and this agent does not cause problems. And so it's very singular because it's easy to prevent, and it is very easily neutralized in its effect on the calves. For these reasons, we hardly ever see E. coli K99 anymore. If I get one call a year about K99, that would be almost a little surprising, okay? And that's important. And occasionally I do. And when they do occur, they are really a problem for the producer until we can get the right antibodies there. This is the #1 reason why I would vaccinate pregnant cows against scours, because that vaccine is so highly effective against this agent. So I'll stop talking about it from here because I consider it to be a problem that is eminently controllable if you vaccinate with one of the vaccines that helps induce those antibodies in the colostrum, okay? Let's look at those other three agents: rotavirus, coronavirus, and cryptosporidiosis. Here's what typifies them. They are a localized infection. They're very much on the surface of the gut. You don't see it, of course, because the gut's inside the animal. But this would be like you getting ringworm on your skin. You don't worry about it invading. You don't worry about getting some kind of other extensive disease. You worry about having itchy skin, and you want to get rid of it. And it's a problem, but really, it actually sort of disappears on its own over time. Now, it doesn't disappear real fast, but these disappear really fast, because once those cells turn over, these bugs are eliminated. It doesn't cause deep inflammation. The body doesn't respond well to it because it's very superficial to the body. It doesn't invade into other tissues. What it does is it disturbs the gut lining cells. Therefore, it affects the ability of the calf to absorb nutrients and fluid and electrolytes, and that's what makes the calf sick. So the bug itself is almost insignificant in terms of its effect on the calf. It's the loss of fluid and electrolyte that hurt the calf. And that's how we come up with graphs like this. A calf with scours caused by one of those three agents, the more dehydrated it gets, the more fluid it loses, the more electrolytes it loses, the closer to death it becomes. And if enough fluid is lost and not replaced, then the calf will die. Good news, because it's a self-limiting infection, many calves actually will get scours, look a little dopey. If you did nothing, many of them would recover. Those of you with children have probably had kids that have gotten this type of diarrhea, crypto, rotavirus, and your kids don't go to the hospital because if they're well-nourished, well-supported, have fluids, they're going to do just fine. They get diaper rash, Okay, so it doesn't have to be a lethal disease. And to show you how common it is, unfortunately, within the industry, we don't do really thorough surveys that really test all calves with Scours. But based on laboratory submissions, here's from diagnostic laboratory submissions, and you can see crypto, rotavirus, coronavirus. Summed together, those overwhelmingly are more frequent than any other cause of diarrhea. Those are the leading cause. If somebody told me I have calves that are scouring and they're 10 days old, I'm a bit of a gambler. I'm going to say, oh, it's rotacorona or crypto until proven otherwise. I mean, I'm serious about this. That's how common they are, and they're everywhere. And I'm going to show you why that's true. K99, which I mentioned earlier, the reason I'm not talking a lot about it extensively is because, as you see, it's the least frequent of those pathogens, because with antibody in colostrum in a newborn calf, it just rarely occurs. It's a very, very infrequent invader, okay? Got to find my button. Here we go. So I just want to quickly go through those three, and I won't spend a lot of time on each of these slides because Travis will have, if those of you want to actually look at those, I gave him a PDF and you can actually look at these more carefully. But crypto, it's far and away the most common agent causing diarrhea. It routinely happens between 7 and 14 days of age. Highly unusual to see it before 7, highly unusual to see it after 14. Can occur, just infrequent. What is important about this, I want you to look at these numbers. The average calf sheds 40 billion oocysts. The infective dose is between 10 and 100. Within a gram of feces, there is enough of this bug from a shedding calf to affect, in other words, 5 million additional calves with infections, okay? Now let's look what happens with rotavirus. One of the most common agents, usually seen between 7 and 14 days of age. Infectious dose, 10 particles. Within 48 hours post-infection, 1 billion viral particles per gram of feces. Therefore, if you did one calf with rotavirus, it has the potential capability to affect 100 million additional calves, okay? So these are easy to spread. Coronavirus typically causes disease for a little bit more extended period, between 7 and 30 days. It's a little more aggressive. It causes a little more severe disease. And so it's a little more troublesome. Good news for you, it also occurs with less frequency, but it can occur. This is bovine coronavirus. So several bovine coronaviruses. If you guys are interested in what that has to do with the current outbreak, I'll be happy to share later, but the real answer is not much, okay? They're just our bugs in cattle, all right? So this gives you a scanning micro or electron microscopic view of what we're talking about. If you look in the picture on the left, these are the normal microvilli, the little rug-like, sort of projections that increase the amount of surface area in the gut lining that allow the calf to both digest and to then absorb fluid and nutrients from the gut. In the middle are the microvilli blunted by rotavirus. In other words, when they infect, they damage these very superficial lining cells, and so the villi, microvilli, become blunted. Coronavirus is more aggressive, and it'll actually destroy those. Now, they'll all grow back, but in the meantime, this calf has lost a lot of its absorptive surface area, and that has great consequence for the calf. So I'll reemphasize, the bug doesn't kill the calf. The bug is going to disappear. The bug's going to disappear in, a few days, maybe a week. All right, could shed for longer, but realistically, not that big a deal from the point of view of affecting other organs. What it does do, though, is it loses fluid and electrolyte. And it does that through several different mechanisms. And we teach vet students about why these are so important, but they're not important. What's really important is if you're a calf with one of these, you lose fluid, you lose electrolytes, you get acidosis, and if it gets really severe, you die. That's, the mechanisms all combine into one pathophysiology that is really deleterious to the calves. In mild affected calves, they're dumpy and they have squirts and they look kind of off. More severely affected calves will be in this bottom corner. And this is from a education article that is one of the common things that we use teaching veterinary students. And what it shows you, it combines a bunch of information here about the loss of body water by the calves, how that's related to some clinical signs that the calves have, and then what appropriate doses of what we call oral rehydration solutions that we can give them. If you give them fluids orally with the right composition of electrolytes and buffers, these calves, almost to a 1, will survive. Now, that may or may not be feasible on the individual ranch in all cases, but I can tell you, because I've done this, when I have the opportunity to have vet students and I say, I want that calf getting oral fluids every 3 hours, I do not lose these calves. They do not die. For you on the ranch, if you can only treat them once a day or twice a day, well, then you will lose a few calves because that's not a sufficient amount of oral replacement fluid. I will suggest that there is high value in paying the attention to make sure they get the fluids promptly, with sufficient volume, with sufficient frequency, and these calves do not need to die, okay? Now I'm going to switch gears. Now we got this other group of problems. The other group of problems is not caused by rota, corona, and crypto. They are caused by bacteria. And these bacteria are very aggressive. Salmonellosis, invasive E. coli, don't be fooled here. There is E. coli with K99, and that only can work through attachment with the pilus. But there are all kinds of different variations of E. coli, and there are a group that we call attaching and effacing. These are similar to, in calves, the type of thing that E. coli 0157 does in humans. 0157 is a human pathogen. It's a normal inhabitant of the GI gut, or the cow GI system. These attaching and effacing, those are affecting cattle, calves, somewhat the way 0157 affects humans, because they have the right antigenic features that give them endowed powers, enhanced powers to have a more aggressive effect on the calf. So what these do now, they beat the dickens out of the bowel. They invade, they cause bleeding, they invade into the blood system, and then ultimately they become septicemic. So this is what that might look like. This is a very aggressive inflammatory lesion caused by attaching and effacing E. coli. In most labs, in fact, I shouldn't say most, I don't know of a lab in the United States who routinely will do the differentiation of E. coli to distinguish whether they fit this term. So if you just submit a fecal culture from calves, you'll always come up with E. coli because E. coli live in the gut. And so that sample is only meaningful if it's also associated with seeing these types of lesions. But these types of lesions with gross destruction of some of the bowel tissue, and then damage down to the vasculature, then absorption through the vascular system, and then movement through the rest of the animal's body systems. Clostridium will do the same thing, and they do it through a combination of invasion, toxins that they produce, toxins that the animal produces to fight them off. And so we have this vicious cycle of problems where the toxin production produces systemic effects, disrupts organ function, and we get really bad inflammatory response and damage, and guts that look like this. If I do a necropsy on a calf with crypto or rota or corona, really, for the most part, the bowel looks pretty normal. If I look at these calves and I open the bowel, you can see that the bowel looks very disturbed. And it's a totally different game, okay? Septicemia is the logical consequence of this. Not all cases get septicemia, but many do. Now we distribute the bug through the blood. It goes to multiple different organs throughout the body. Inflammation is now widespread throughout the whole animal, and there are a whole bunch of the mediating factors. Those of you familiar with some of the discussion about COVID, and there have been notions that some of the COVID-affected patients get myocarditis, or some of them get vascular disease. That's because once the agent is moving through the system, now it can cause a whole bunch of different effects on a number of different organ systems. Look how different this is from the first group of problems I talked with you about, because these calves are in deep trouble, all right? And the reason they're in deep trouble is because they don't just have diarrhea. They're not losing fluid. They're trying to stay alive with this bug invading a whole bunch of tissues. And this gives you some idea. In fact, these have names. This is a calf with meningitis. The bug has invaded into the brain. This calf is completely well hydrated. It hasn't lost any fluids, but it's totally gorked out, and it's going to die. We can't save this calf. This is a kidney, and you can see a bunch of little red speckles here. That's the invasion of the bacteria into the kidney tissue. as these mature, these will become little abscesses, and we call it white spotted kidney disease. That's E. coli septicemia. You'll see some of these animals, most notably is typically Salmonella, will appear to develop pneumonia. And yet the pneumonia will be occurring in a 3-4-week-old calf, which is kind of weird because that's not when that's right, because it's not spread through the respiratory tract. It's coming through the bloodstream, and it's just blitzing the lungs, because now it's able to spread through all of the lungs. You might find calves with joint disease. Those are all the effects of septicemia, all right? And so that's a completely different game now, okay? And when they do laboratory submissions, again, sadly, we don't have a robust sort of system that systematically goes and collects agents from calves. And so this is all based on laboratory submissions. But are there two standout bugs here? Absolutely, Salmonella and E. coli. That's what causes septicemia. And so those are really big league infections. Now, I just made it sound as though, of course, each one of those agents is operating alone. That's commonly not true. In fact, the most common thing is if calves get crypto, they might also have rota. If they have rota, they might also have crypto. That's a very common thing because they're all sourced at the dam. The mature animals carry these bugs. You should consider them more like an environmental toxin because you can't eradicate them from a herd because they are native to the animals. But in mature animals, they have no effect. But in the baby calves exposed to them, then they can replicate. And so their home, where these bugs want to be, is in a baby calf where they get replicated like there's no tomorrow. Those were data I showed you before. Furthermore, you could have damage and issues with infection in the bowel that then spreads septicemically with different types of agents. Most septicemic calves have some level of poor passive transfer because now the circulating antibody should be what picks up those bugs as they invade. So calves with less high quality passive transfer are the ones who will typically be affected by septicemia. So it's when I tell you this, I just like to back away a little and say, however, there are mixtures of these infections, and it doesn't all have to fit into one category versus another. It's a continuum. What I do want to share is that in the main, if you see calves with Scours and they fit a certain clinical pattern, on average, they don't have a lot of bacterial infection. Alternatively, if you see calves with systemic signs, evidence of pneumonia, evidence of depression that exceeds dehydration, then typically we have some kind of a more invasive pathogen. So it's really not that hard to tell the difference. So the learning issues so far, the most common causes of calf diarrhea are crypto, rota, and coronavirus. This is calf Scours. They occur most commonly between 1 and 2 weeks of age. Occasionally they'll reach outside that time frame, but if I have a producer call me and they can define the age at which the calves became ill, and if it's that 10-day window, I'm going to say, odds are with me. If I'm a betting man and I'm in Vegas, man, I'm calling this Scours, okay? On the other hand, you tell me you got calves at 30 days of age, 5 days of age, a bigger distribution, I'm going to say, ooh, that's probably not just Scours. But the Scours agents hurt or kill calves by causing fluid and electrolyte loss. And so what's important here is that antibiotics don't affect these bugs because antibiotics are totally ineffective against rota, totally ineffective against corona, and totally ineffective against crypto. Why is it then that when I talk with producers and they tell me how they've treated the calves and they're having poor treatment outcomes, and they tell me, yeah, well, I treated them with those Scours boluses, which are typically oxytetracycline, neomycin, a few other things. And I'll go, first of all, you wasted time. Second of all, you wasted money. Third of all, you gave antibiotics to calves where they're not going to do any good. Fourth, they're putting them in the GI tract where we have no idea how well they'll be absorbed, and we're not going to have any efficacy anyway. But they were approved 30 years ago, and so they're still on the market. And so a lot of producers still give pills to calves. It's irrational, actually. It's not good. And the more I can get people to get away from that and use more rational therapies, the better off for everybody. Bacterial infections, on the other hand, they can cause diarrhea, and you can see Scours in those calves, but most commonly they invade other tissues. In fact, many calves with Salmonella, I've seen a lot of these calves, will show you respiratory disease and a little bit of loose feces, and they'll look horrible, but they're not pouring water out the back end. Same with Clostridium will kill calves, and you'll never see diarrhea because it kills them so fast. The toxins are so bad that you never see the diarrhea come out. When these affect the gut very viciously, the calf gets what we call ileus and pools fluid in the bowel, so that what you have is a full belly calf with no feces anyway. So in other words, they're not noted for a lot of diarrhea. They're noted for their effect on calves that spread beyond the GI tract. These occur over a broader time range, 4 days up to 30 days. They kill calves by invading and causing bad tissue inflammation, and antibiotics may be useful against these bugs. But if you're going to use antibiotics here, there's very little value in giving them pills. You want to give them a parenteral antibiotic. You want to give them an injectable antibiotic, because what you're trying to do is get it systemically distributed that hopefully will neutralize the bugs before they do severe damage to the other organs. Okay. So now how do we identify this? Because I'm going to suggest that any producer that, uses a reasonable approach to evaluating the calves and don't lump them all into, oh, sick calf with diarrhea, therefore give them pills. Don't do that. First, you want to look at what the history is. We all run herds. And so if you know the time distribution, that's clue number one. The second clue will be physical examination. So if you look at these calves, there are a bunch of things we do physically that are designed to evaluate dehydration, the hydration status of the calf. So we look at the skin tent. So if you pinch the skin, what makes the skin pop back into place is fluid in the sub-Q, fluid that's under the skin. When that fluid diminishes or disappears, the skin tent doesn't go away. So when you pinch the skin, it stays there for a long time. We look at strength and activity. If the calf is weakened by dehydration, they'll slow down, they'll look dopey, they'll look depressed. I often tell producers, if you can catch the calf, it needs fluids. When you can't catch the calf anymore, it's probably doing just fine. And so strength and activity, eye globe position. The picture here is showing you an eyeball sucking into the head. Why is that? Because what keeps the eye globe pushed out towards the surface is a fat pad behind it that has a lot of fluid in it. As the calf dehydrates, then the eye sucks in. You might notice that in very emaciated animals, the eye also sucks in. That's because the fat pad disappears. But these calves theoretically are not emaciated. Therefore, the reason the eye sucks back into the head, what we call enophthalmos, is because it doesn't have enough fluid. Then we look at peripheral perfusion. You look at the gums, the membranes, and they will all be pale because they don't have enough perfusion to make them red. And then you relate that to diarrhea. If they're going to be losing fluid, well, it better be going someplace. So that's what we do. Those are evidence of dehydration. On the other hand, we could look at other aspects of the physical exam. And these are not related to dehydration, they're related to inflammation. So you see this calf's eye over here? You see, we call this an injected sclera. You see how prominent those blood vessels are? This calf has septic shock, not hypovolemic shock. It's not going depressed because it doesn't have enough fluid. It's getting depressed because there's all this inflammation that is significantly affecting its circulation. And so the blood pools in the periphery. So instead of having pale mucous membranes, they have reddened mucous membranes. They also have severe decrease in mentation, so they're really dopey, but they're dopey exceeding the level of dehydration they have. They lose their suckle reflex because they're very depressed. They get depressed because of the acidosis. In many cases, they have increased abdominal fill. When you examine this calf and you feel its belly, instead of being empty because the fluid's shooting out the back end, they're pooling fluid in the belly. Tubing these calves with fluids is a singularly bad idea because if they were absorbing fluids, they wouldn't be pooling in the belly. So these calves, if you're going to treat them with fluids, really, really need intravenous fluids. And then you look for extra gastrointestinal involvement, which would be things like swollen joints, things like severe depression, things like pneumonia, evidence of respiratory problems. So basically, the things that suggest septicemia are red inflamed mucous membranes, prominent scleral vessels, depression that exceeds the amount of dehydration. Because of what I told you about Scours, if you have a calf that is mildly dehydrated, it will be mildly acidotic, it will be mildly depressed. Calf that's moderately will be moderately. A calf that's severely will, if we get severe depression, like that calf I showed you in a previous slide, and the calf has normal hydration, That is not because of scours. That's because of some other disease effect, which usually is because of these invasive bugs. Profound depression without severe diarrhea or multiple organ system problems, okay? So we look at groups of things. We don't just look and say, calf has fluid feces, must treat with pills. No, 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 bad response. You say, calf looks bad, let's take a look at it. And then when you see depression, dehydration, and diarrhea that are all pretty closely matched, and the calf is say 8, 9, 10, 12 days old, you got scours until proven otherwise. And so now we will treat with fluids. Whereas if you have significant inflammation, extra gastrointestinal problems, then those will suggest something more advanced, more severe than the scours, all right? And we look at age, clinical course, and history. The reasons we do this are because the prognosis and the treatment and the outcome of these calves are very, very different. The prognosis is extremely variable. For simple scours, I can tell you that if you can supply them with enough fluid and electrolytes, most of these calves will live. So when somebody tells me they're losing calves to scours, one of two things is true. Either they're not treating them properly, or they're not treating them enough, or they don't have scours, right? So when I get bad outcome, it means there's one of those things is going to be true. For septic problems, you can treat them with whatever the heck you want. When you have salmonella coursing through the bloodstream, affecting the liver, affecting the heart, affecting the lungs, affecting the brain, the likelihood of you succeeding in your treatment is extremely low. I can tell you, even when I used to work in the internal medicine clinic, my success rate with these calves is maybe 10%. So in other words, the real issue with septic problems is preventing them, because you're not going to save them once they're severely affected. Scours. The key treatment here is fluid therapy. If I haven't made that point clear, I'll just double down on it. Oral, subcutaneous, intravenous, all of those are viable. Cheapest, most effective early, and very effective and inexpensive is oral rehydration solutions. Oral antibiotics have very limited efficacy and may be deleterious. In fact, I'm going to tell you they are deleterious. For the drugs that are given that way, most commonly, if you take oxytetracycline and neomycin, put it in a bolus and give it to a healthy calf for 5 to 7 days, the calf will develop diarrhea because you screw up all the bugs in the gut. And so as we've gotten smarter about antibiotic use, of all the things I can think of, this is the poorest use of antibiotics. Now, if you think you have a Clostridium and you give the calf oral penicillin because, you know, that's been touted, I can justify that because that's very effective against Clostridium. Whether you'll save the calf or not, I don't know, but at least there's a rationale to the treatment. But giving those pills to fight scours just doesn't make any sense. Adjunctive treatments, people will give Pepto-Bismol, people will give anti-inflammatories, people will give a wide variety of things, psyllium mucilage, try and change the, composition of the feces. But realistically, most of those things have limited efficacy. I'm not saying they're harmful. You can treat if you want. Number one, you give me fluid therapy and I'll beat every other therapy you got in terms of saving calves. It's that simple, okay? And that's why we develop these charts like this, which I showed you before, and you can study if you'd like, and I'll encourage you after this that if any of this is new to you, I will highly encourage you to have a meeting with your veterinarian and say, hey, I want to know more about this. Show me how to evaluate dehydration, because I can't do that very well on a Zoom talk. For bacterial enteritis and septicemia, fluid therapy may be helpful. If you're going to administer it, it really has to be intravenous. The calf is not going to absorb it through the gut. And it's probably worth doing because you can't just turn your back on these calves, but be warned that the likely efficacy of that is not real high. If I were treating these calves with something intravenous, I'd rather use plasma, because plasma is actually it's a colloid fluid and it actually supports the circulatory system better. But man, we're talking several $100s of treatment for a prognosis that's maybe 10%. So it's rarely done. Antibiotics, very limited efficacy. If they are given, you should be administering it as a systemic dose, either IV or intramuscularly, depending on the antibiotic. Adjunctive treatments may have value, but the prognosis is poor one way or the other. So the key is going to be in prevention, okay? So the last things I'll say about diagnosis are two very practical things that I'm very disappointed very few people use. One is response to treatment, and the other is necropsy. In terms of response to treatment, based on what I've shown you so far, if you are treating calves with simple scours, where the main problem is diarrhea and dehydration. And if you treat Scours calves early, and when they have mild or moderate fluid loss, and if you use oral fluids and electrolytes with the right amount and composition, then response to treatment will be good. So the proof's in the pudding. If you were to follow this and you didn't have that effect, then if you use oral fluids and electrolytes with the right amount and the calf response is poor, or if you have calves where you can clearly identify you have a more complex problem, then you need your veterinarian. Then you really ought to be consulting about what potential adjunctive treatments you can do. And I'm going to suggest that the treatment efficacy will be very limited. I'm very disappointed that throughout both the veterinary and the beef cattle worlds, necropsy is grossly underutilized. Everything I just showed you now suggests to you, I hope, that if you had a sick calf that died, what's the simplest thing you could possibly do? Almost everybody on this call is a hunter. You know how to open an animal up. If you don't, this is a pretty simple thing I can teach you. And why do people let calves, when they do die, I'm not saying you let them die, but in the event that they die, well, let's look inside and see what's going on here. And you got a cell phone. And so if you took a photo of it and you sent it to your vet, ideally, I'd like to think that the veterinarians do more of this, but I do get it. They're, off over here and off over there, and they can't be here till tomorrow. Well, then, okay, then they're not available to do the necropsy. I think I'm talking to some pretty darn competent people. And I think I can show you how to do a necropsy very easily. And I have every confidence that you can pick out normal from abnormal after about 2 cases. So it ought to be used. The saddest thing is I get calls from people with regularity, and they'll tell me, well, yeah, I lost 8 calves last week. And I'll go, so what did the necropsy show? Oh, I didn't necropsy any of them. Oh, really? How many do you have to lose before you're actually going to look at the problem? And I really think that needs to be coordinated and better done. It's very simple. You can do a necropsy in a baby calf. I mean, I'm really not exaggerating here. If it takes you more than 20 minutes, it means you found something really interesting that you had to explore. Seriously, because it's not that. And that's where you collect samples. And if you're working with your vet and you say, what samples should I collect? If you don't have, Whirl-Pack bags, you put them in baggies. And then you know what you do with the baggie? You put it in your refrigerator, your freezer. And if you think you don't need it, you throw it out. But to not do the necropsy and collect the tissue is like an opportunity missed. If everybody who ever called me about dying calves had done this, we'd solve the problem a heck of a lot quicker, and typically for a lot less expense. And so I don't know if you guys would agree with me, but one of my heroes in the world is Sherlock Holmes, because he was like a really great problem solver kind of guy. And as he said, it's a capital mistake to theorize before one has data. Insensibly, one begins to twist facts to suit theories instead of theories to suit facts. So the notion is that you gather some information, and I'll relate a little to what one might do. I think every producer should track with regularity when calves get sick relative to their age, the age of disease onset, how many calves got sick, what day they got sick, and have an identifier that says, thought it was simple scours, as opposed to just sick, right? Or GI. And then look at which percentage of them or what of those die versus get better, and then necropsy and diagnosis. Those are things that you do like every day. It's just a matter of accumulating that information. And then if you call me because you want some advice, and I can say, so what age are these calves getting sick? I love the day when somebody says, well, they're pretty much between about 7 and 10 days of age. That's a great thing to know. The response I usually get, well, I don't know, geez, they're all baby calves. And I'm going, meaning you actually didn't pay attention to when they got sick. These are key features of what this is. And I hope I've driven that point home here. So there's just a couple more slides just to sort of emphasize why that's true, why that's important. When we look at infectious disease prevention, we're looking at a balance between minimizing exposure and maximizing resistance. Now, I already shared with you that these are crazy infectious agents. This is much worse than our concern about the pandemic here in terms of the ability to have a propagated epidemic. When you congest a whole bunch of animals in the same environment and those calves breed this bug, then routinely you're going to enable the infection of the next group of calves, the younger calves. So we look at things like hygiene, moisture, animal density to decrease exposure. And then we look at things that maximize resistance, which are things like dystocia management, perinatal calf care, making sure the calves suckle their dam promptly. If not, then you give them, you either milk the dam or give them a colostrum replacement, and then optimum nutrition. That's the way we minimize infectious disease. And that is why the Sandhills calving system, which I hope you guys have heard of, works so well. It works so well because each new crop of calves every week is being born in a new location, not contaminated by the preceding group. So you minimize the likelihood of what we call a propagated epidemic. If, on the other hand, you have cattle gathered up, I'll bet you every person on this call has seen this happen and marveled at it. First 2-3 weeks of the calving season, nobody gets sick. By week 3, maybe 4, you see your first Scours case. And from then on, through the rest of the calving season, the incidence is just going to increase, especially if you got really bad weather. If you can break that cycle by decreasing the likelihood of this propagated epidemic, you can. I know many ranches that have like almost no Scours at all. That can be achieved. So I hope what I've done is shown you some of the reasons why you can allocate these things into different groups and why it drives treatment decisions and why it is the basis for setting a prognosis and then potentially a preventive program along the way. And I hope that was useful for you. And I would be happy to field some questions if there are any. I told Travis that I finished by 1/4 and I think I'm on by a minute or so. So we got like 15 minutes here.
Well, there you go. That works pretty well. I'm going to, first of all, put in the chat the link to our evaluation form so that you guys can give us some information back. Dr. Garry, you kind of hit mine there. I was going to ask you about Sandhills calving and how it worked and what, you moved. The example you showed there was moving cattle every week. If it's not possible, we don't have enough acres or pastures or whatever to move. The one I'm familiar with, it's about every 2 weeks they move the cows that have not calved. And I think a lot of people get confused about that. We're leaving calves of the same age and group in a pasture at times. So I think you covered that one for me.
But I would comment, Travis, if that's helpful. That got a name, therefore it is like this technique. But really, there's a lot of ways to skin a cat. And so I will suggest that if you don't have a lot of different pastures that you can move groups of animals, or you couldn't move them as frequently, then you can accomplish much the same thing by, for example, really promptly getting pairs out of there. I know many people who will have pairs and they'll be in the calving area, just still congesting the place for, prolonged periods of time. Well, that gives them not only the chance to get infected, but it also, if you leave them there long enough, the chance to contaminate. And the dams will do that too. You could also stage when you bring animals up into the calving, the intense calving area. So for example, if you got animals distributed over several weeks, only bring the animals up to the more congested area as they approach. Then you keep the area cleaner. So you can look at a bunch of different ways to accomplish that. The main thing about the Sandhills calving is that if you follow that formula, it is a really good way to put newborn calves on new ground. And if you can do that, that's the magic.
Okay, that answers that question. I know we didn't talk a lot about Clostridial things tonight. C&D, we have some producers that struggle with that at 2 different levels. We have usually what I find is those individuals that struggle with those calves that are 3 to 45 days old, 3 weeks to 45 days old. But I have also seen it where we have a particular producer that I'm familiar with is having that problem with 2 to 4 day old calves in terms of C and D, Clostridials, and we also have issues with type A clostridials in a few herds. Can you speak to that?
Mm, that's a pretty broad topic.
Okay.
Yeah, I would first make that distinction of Clostridium A versus the C and D types, which are the lower bowel. That's actually the power of the necropsy, is typically if you're experiencing a Clostridium A problem, then it will most commonly manifest in the abomasum. That's why they blow it up and get colicky and then, and then die, and they rupture the abomasum or get an ulcer. Whereas with the picture I showed you there, that was a Clostridium. That's an enteritis that is affecting the lower bowel, the intestine. That's way more common for the C and D types of Clostridium. The vaccine, and so the first thing to think about is how good is the vaccine program against C and D, and as compared with A. The problem with A is when they create the C and D vaccine or the 7-way vaccine, whichever you use, it doesn't have nearly as much efficacy, potency against the alpha toxin. And that's because that as they take the supernatant off, that is this antigen, the antibody that you're directing it against, it's a toxoid, you have a lot higher levels of the C and D than you do of the A. And so some years back, some people tried to create a more successful Clostridium A vaccine, and it just really never got on the market. It didn't prove to have good efficacy. But some people will create, if you have a case like that, and you do the necropsy, and you recover the bug, which now requires several things in a row, you can send that off to Newport Labs, and they will create a homegrown variety of the Clostridium perfringens A, and you could use that instead. Those vaccines, those toxoids, are really the best protection against that because they induce high levels of antibody that minimize the likelihood of problems, okay? But even with the vaccine, what will happen, and it's the problem with Clostridium, is that it doesn't follow those epidemiologic patterns I showed. It tends to occur sporadically and explosively in a very few calves. The most common times that happens is when there's some disruption in the normal feeding pattern. Calves love to have great consistency to when and how they nurse, when they eat, and what the stuff is. So if you have older calves that get Clostridium, most common time that occurs is when all of a sudden their diet changes to something that has a lot of sugars in it, like new green grass, which is why a common thing people see is Clostridial enteritis in calves, as they get turned out onto green grass. That's reasonably common. And alternatively, in these baby calves, you have to look at things like, was there some event that changed their ingestion of milk, or that kept the dams, separated them from longer, which therefore changed the volume that they ate, which therefore overfilled the abomasum, which therefore allowed more fluid to leak into the lower bowel, and that's what spurred the overgrowth of the Clostridium. So, short version of all that, most important to me is to make sure they have a really good vaccination program of the prepartum dams. And the second is maintain as much consistency as you can in the environment of the calf so that its consumption of milk is consistent throughout that period, as consistent as you can make it. Don't separate dams and calves, don't feed at different times of day, those kind of things. And I feel bad, but we will always have that problem. It crops its ugly head. And the real good news thing is it tends to come and go. So, big outbreaks are uncommon. Sporadic conditions are way more common. I don't know if that's helpful. That's what I would offer you.
Kind of as a follow-up to that, Curtis is asking if Clostridium perfringens type A is really an issue. He says that they have found it in diarrhea calves and abomasal ulcers in their herd.
Right. So I'm misunderstanding the question, because that is correct. If you see abomasal ulcers in calves, our current understanding is that the most common reason for that is going to be Clostridium perfringens A. So if you were to see that, especially the explosive ones where they get a blown up abomasum and colic, and then they develop the ulcer, most commonly leading to bad peritonitis, and then they die pretty promptly, that would be classic Clostridium perfringens A. So I'm not sure that, I don't think I answered the question. I think but that would be a clear association. Yes, that's true. And so, yeah, I consider that a big problem. In terms of what you can culture, the labs do one of two things. You can culture Clostridium perfringens in an affected animal. Some labs will try and be more restrictive in their diagnosis, and if they don't find the toxin, then they aren't confident that the Clostridium perfringens caused it. Clostridium are very, very common soil-borne organisms. And actually, we know that from the occurrence of, say, tetanus. If you didn't have a tetanus shot and you got a laceration in your foot that became anoxic, the tetanus bug is like everywhere. Clostridium is in the cow gut. Clostridium is in the soil. And so we're never going to avoid the bug. You'll never actually diminish the potential for the bug to be there. What we have to do is change the likelihood that it can excrete its toxin, which is what the vaccine is about, or that it overgrows, which is what the management is about.
Okay. I hope that helps, Curtis. I've got another question that I want to ask in regards to fluids, because you can go in and buy every kind of electrolyte fluid, anything that comes through. Everybody has something that they're going to treat with, and I see you're scrolling here.
Yeah, I am indeed scrolling, and I'm gonna do you a big favor here, because that's the most common question I get, but I don't usually take the time within the talk to talk about it. And so if somebody doesn't ask, I just say, yeah, they'll figure it out. But yes, there are good fluids and not so good fluids. All the fluids that are made have a purpose. The problem is that people will market them as though they're good for calf scours when they're not. So I'm not bashing the fluid, I'm saying they're inappropriate. For scours therapy, we need to maintain and improve hydration, correct acid-base balance, and supplement the appropriate electrolytes. So since we know how the disease occurs, we know what that composition would be, okay? And so I just want to scroll down here. And so these are the electrolytes we need to supplement, and we need to have a base in what we call a buffer, or an alkalinizing agent, it might be called, or a base buffer. And so that in some cases is bicarb, but in other cases would be something like acetate. Okay, I could go into this physiology, but the point is this: you need to have a sufficient amount of sodium, you have to have a sufficient amount of chloride and potassium, you need to have alkalinizing capacity, and then you need something that it promotes sodium absorption, which either glucose or glycine, and you need to keep feeding milk, because these don't have enough energy to keep the calf alive. So you let the calf keep nursing and you give the fluids in between milk feedings. You're trying to add fluid, not replace fluid. All right. So those are the stipulations. Given that that's true, our alkalinizing agents could be either bicarbonate or acetate and propionate. In recent times, we used to use a product that always had bicarbonate, and there was concern that the bicarbonate would change the acidity of the abomasum and potentiate Clostridium problems, just like what you identified. And some people have believed they've seen that. I have not. I have used those bicarbonate agents years ago in a product that Pharmacy Upjohn made that was just outstanding. However, the new mode is to use something that alkalinizes the calf, but does not alkalinize the abomasum. And the two for that are acetate and propionate. So now those are the stipulations. You don't have to remember all that. That's just why some fluids are good and some fluids suck. So here are some products that I have heard from people using for scouring calves. And I will guarantee you that none of these are worth a damn. Why not? They don't have an alkalinizing agent. If you want to give them to a calf on a hot summer day with respiratory disease and pneumonia that's losing fluid and needs some electrolyte support, if you want to give them to a calf post-shipment, if you want to give them to a calf going to a feedlot, all right now, that's a good idea. Do not fool yourself into thinking that any of these will do anything to save scouring calves, because that's just really a myth, okay? Here are some good choices. And these are good because they are very effective, but they all have high levels of bicarb. And there's argument here, because as I just told you, I've used bicarb in alkalinizing fluids 35 years ago when we weren't worried about this, and did just great. However, the theoretical argument that it potentiates Clostridium rings true to me. And so there are better fluids. The better fluids are these. These are hands down the very good choices. Land O'Lakes Base Pack plus Add, DiaQ, Hydrolyte, Epic Calf Electrolyte. All of them have the same characteristics as those other three, but they also have acetate instead of bicarb, and theoretically are a lot safer in enhancing enteric health. So, and I don't remember if I actually put them in the slide deck I gave you or not, but if people have questions about it, let me know. But if these all ring true to you, those are the ones that really work.
Well, we recorded this.
Super.
So we'll be able to let them go back and freeze the recording and write down whatever they would like to get off that. So
okay, super.
Do I have other questions in the chat here as we approach 6:30? Anybody else have something while we have Dr. Garry on the hook for an evening?
I'm really glad you asked the fluid question, because I actually hadn't included that in the thing, and I thought, should I not? And that'll take too long, and maybe nobody really cares. So I appreciate you asking it, because it is important. And most people just say use good fluids, and then they never tell them what the hell the good ones are. So, and then I see somebody using Resorb, and I just want to cry.
So with that, we're closing in on the end. Dr. Garry, if you'll stop sharing, I got something I'm going to put
wait a
minute.
Here. I got to find that thing. Here we go. I got it. Stop share.
I want to thank Dr. Garry for being here this evening. I really appreciate that. I'm going to share a screen with you if I can find the one I want. Right here. I'm going to share because this is the last one. Tell me if you can see my drought 2021.
Yep.
MJ, can you see that? We put together something. One of the things that has come out of all the surveys that you have given me is that there needs to be something dealing with droughts. And we have some speakers that will be coming up. This is a roundtable session. It's a little different. We're going to have actually five videos, including a weather outlook, forage options with Dr. Valesky, grassland endurance, living dry, dealing with what's important in a drought plan, as well as some information for you. But to register that, it's just my email that most of you have been seen coming through. So if you're interested in some drought information, those videos will be posted so you can watch them at your convenience. You don't have to tune in at 5:30 and have a nice beverage with me this time, but you can watch those at your convenience. And then we're going to have a roundtable session with the presenters on February 25th. So if you're interested in that, please contact me via my email. Now I'm going to stop my share. I'm going to say thank you guys all very, very much for being part of this program. And we're going to sign off with Better with Beef Happy Hour until I think we'll do this again. We had enough support and topics. We'll probably plan this again for another session come next January. So for those of you, thank you very much. Thank you, Dr. Garry. We're going to sign off and hope that you guys indeed have a happy time and a happy hour as we go. Thank you very much.
Thanks, you guys.